Xin chào mừng quý vị và các bạn quay trở lại với chương trình Tôi và Việt Nam trên kênh truyền hình FBNC. Phỏng vấn bà Sue McKinney là tổng giám đốc của công ty Crila Health. Chúng ta sẽ tiếp tục cuộc trò chuyện với vị khách mời này nhé. So let's continue our discussion on Crila. It appears that Vietnamese herbal plants used in Crila provide very significant and also visible benefits. So, are there any other herbs specific to Vietnam that you believe could do well on the international market?
Absolutely. Where the Amazon rainforest claims 12,000 species of plants, Vietnam claims 20,000, little tiny Vietnam. And 4,000 of those are cataloged with medicinal effect. Now, there is an ethnobotanist, Dr. Suharto from the University of Illinois, Chicago, Department of Pharmacognosy, plant-based medicine, working with colleagues at VAST, the Vietnam Academy of Science and Technology, in one national park in Vietnam where they have found 200 previously unidentified species of plants. This is generations of work, and who knows the medicinal benefits that will result from that. The health and wellness market is billions of dollars. So, for instance, now one of your top seafood companies, Vinh Hoan, has developed a product apart from their seafood processing that takes advantage of the other materials to make very high quality collagen peptides and gelatin. I have a Crila customer in Belgium, a professor and doctor of science at an institute there. And he started ordering Crila for his prostate.
Oh, very nice.
And he wrote to me and he said, I've tested this product in my laboratory at the institute and I understand why it's working to benefit my prostate. And I'd like you to know that I'm also part of this Pacific Blue Corporation in Vietnam. And I'd love for you to go meet my colleague, Dr. Hong, because I think there are other things from Vietnam that could be developed and exported. So Dr. Hong has introduced me to a kind of algae that they're growing. And again, it's a closed system. They're making it, they're purifying it. And this algae can produce a very high quality protein product, powder, that can be mixed with liquids for cancer patients that had difficulty to eat, or older people that have difficulty to eat and get adequate nutrition. So they've asked me to explore the US market and see if we can do the product registration there. And I'm delighted about it. And I know there are others out there.
Right. Another popular herb native to the Southeast Asian regions is moringa. I think you have heard about that sometime. And this plant has been marketed heavily in developed countries. However, consumers have expressed only marginal benefits. So what distinguishes Crila from these types of overhyped products?
The clinical research behind it, including now we have clinical trials undergoing in the US now to add to the clinical trial evidence from Vietnam. The University of Illinois Chicago has been testing Crila under a grant from the National Institutes of Health. The US government is paying for the university to test our product, which I think is terrific. And the specific proprietary testing the university could do was to test Crila for estrogen receptors, because the benefits from Crila could lead you to conclude that it's a phytoestrogen, a plant-based estrogen. But Dr. Cham always insisted it was not, but she couldn't prove it here. The university did, and when the first test results came back, they said, oh, but that was unexpected. Logically, it should be a plant estrogen, but it's not. Let's test again. And we said, great, let's test again. Now they've come back and said, okay, you've got our attention. This is really big news. And you'll see that on the Crila label now, that here is something that beneficial for hormone balancing, that does not contain estrogen, will not stimulate any known estrogen receptors in the body, and that's big news. So that distinguishes Crila from a lot of other projects. And the ongoing testing that we're doing in the US and that Dr. Cham is doing with her colleagues in other countries to add to the knowledge about what Crila can do.
And I understand that you are here for more than just business. So as a very active Rotary Club member, you have launched very important projects such as Operation Smile. So can you share more about your social work?
Well, I was asked to formulate the board of Operation Smile in Vietnam many years ago, and I chaired the board for 1 year and served on the board for 9 years. So I didn't launch Operation Smile. It's been in existence for quite some time, but Vietnam is their most successful country for Operation Smile outside of the U.S. And yes, Rotary clubs have supported Operation Smile in Vietnam. This again is a story of how international and worldwide social entrepreneurship can be. Since I've been in Vietnam a little over 21 years now, I've been the in-country liaison on 21 Rotary projects in Vietnam.
I see. Is there anything else that you would like to add for your story?
Well, the most recent Rotary project, we just did this last summer that I'd like to share with you because we'd like to do it again.
Right.
So this is the child-size version of a virtually indestructible soccer ball.
Oh, yeah.
A soccer ball in the wild in harsh conditions can last an hour before it gets punctured, and then you need the pump, you need the repair. This was developed by a man in Berkeley and is a virtually indestructible ball. You can deflate it and it will automatically inflate. So it lasts for years.
Wow.
And my Rotary Club, Oakland Sunrise, in collaboration with my friends San Jose East Evergreen Rotary Club in California, we came together with One World Play Project that makes this ball. They're a social enterprise in Berkeley, California. And we sent a container of 2,400 balls to Vietnam in the summer. Then we brought over Interact and Rotaract, the high school and college level of Rotary kids, to help us distribute the balls throughout orphanages and schools in Vietnam and teams.
I see.
And it was very exciting. We'd love to do it again. Aid for Kids is the NGO under which is handling the distribution for us, and also a fabulous organization up in Hue. Football for All in Vietnam is another organization with a program teaching and training coaches, providing uniforms. They insist that half the teams be girls' soccer teams. And again, they have a fabulous project utilizing the technology of this ball for their teams. And
I see. So
we'd love to see that spread out more.
Thank you so much for this. Yeah, I think very meaningful for the children in Vietnam. And it appears that you have contributed a great deal to the social and also economic developments of this country. And I believe you will continue to do so. So thank you very much for being here. And I wish you continued success.
It's my pleasure. Come on. Em come to hang up lại.
Thưa quý vị và các bạn, vừa rồi là những chia sẻ của bà Sue McKinney, tổng giám đốc của công ty Crila Health trong chương trình Tôi và Việt Nam trên kênh truyền hình FBNC về cuộc sống cũng như về công việc của bà ở Việt Nam. Trong 21 năm sống và khởi nghiệp tại Việt Nam, bà đã có những đóng góp to lớn cho sự phát triển của nền kinh tế. Đến đây chương trình xin phép được khép lại. Xin chào tạm biệt quý vị và xin hẹn gặp lại trong chương trình lần sau.